Hello, today we're going to talk about valvular heart disease. So valvular heart disease describes an abnormality or dysfunction of any of the heart's four valves. So the mitral and aortic valves, which is the left side, the tricuspid, which is the rear, might occur as a result of like endocarditis or IV drug use, and then the pulmonic valves, which is the right side. This affects the efficiency of the heart as it pumps it and reduces stroke volume. So over time, there might be remodeling of the heart itself, so like hypertrophy and even heart failure. With age, fibrotic thickening occurs in the mitral and aortic valves, and the aorta is stiffer in older adult patients, increasing systolic blood pressure and stress on the mitral valve. So what we have is health promotion and disease prevention, and we want to prevent and treat any type of bacterial infections. We want to encourage clients to consume a diet low in sodium and to follow fluid restrictions prescribed by the provider to prevent any type of heart disease. We also want to control chronic illnesses such as diabetes mellitus, hypertension, and hypercholesterolemia. We also want to encourage exercise or the ability to be active and increase your exercise to boost low density, those lipoproteins, so that LDL levels. In your assessment, for instance, we have the valvular heart disease. It's classified as either stenosis or insufficiency and improper closure. So stenosis is the narrowing opening that impedes blood moving forward. And insufficiency and improper closure are some blood flows backwards, so it's like a regurgitation. Valvular heart disease can be congenital or acquired causes. So, for instance, congenital valvular heart disease can affect all four valves and cause either stenosis or insufficiency. The acquired is a valvular heart disease is classified as one of the three different types. So we have degenerative disease, which is like due to damage over time from like mechanical stress or like the atherosclerosis that we talked about earlier, and then even like hypertension. Most common is usually in developed countries, for instance. Rheumatic disease is gradual fibrotic changes, calcification of valve cusps, most common in developing countries also. And then we have the ineffective endocarditis, which is an infectious organism that destroy the valve. So this is specifically like your streptococcal infections are the most common cause. So we see this here in the United States. So some of your risk factors that we have is hypertension, rheumatic fever, so like your mitral stenosis and insufficiency, your ineffective endocarditis, any type of congenital malformations. They talk about like the Marfan syndrome, so that's your connective tissue disorder that affects the heart and other areas of the body. And then in older adult clients, the predominant cause of valvular heart disease are degenerative calcifications and atherosclerosis, papillary muscle dysfunction, and even ineffective endocarditis. So some expected findings that we're expecting to see. Clients who have valvular heart disease are often asymptomatic until late in the progression of the disease. A murmur is usually heard with turbulent blood flow. The location of the murmur and timing, so diastolic versus systolic, help determine the valve that's actually involved. So murmurs are usually graded on a scale of 1, which is very faint, to a scale of 6, which is extremely loud. Left-sided valve damage usually causes increased pulmonary artery pressure, left ventricular hypertrophy, and decreased cardiac output, all resulting in like orthopnea, paroxysmal nocturnal dyspnea, so that PND, and also fatigue. So some symptoms of mitral valve stenosis include like your apical diastolic murmurs, shortness of breath, especially with like activity or when you lie down, fatigue, especially during increased activity, swollen feet or legs, sensation of fast fluttering or pounding heartbeat, dizziness or fainting. Again, we have that fluid buildup in the lungs, irregular heart rhythms, chest discomfort, and it could even be coughing up blood. Now, this is the mitral valve stenosis. The insufficiency, so the mitral insufficiency symptoms, refers more to like the systolic murmur at the apex, so you're gonna hear that S3 sound. Fatigue is a common but non-specific symptom. Other signs and symptoms of mitral valve regurgitation include like the sound of blood flow across the valve, so like your heart murmurs, your irregular heartbeats, shortness of breath, sensation of rapid pounding or fluttering heartbeat, and your swollen feet and ankles, so your edema. Symptoms of aortic valve stenosis may include like a systolic murmur, dyspnea on exertion. Here you're going to hear the S4 sounds. A lot of times they'll have angina, syncope, fatigue, dizziness, fainting, orthopnea, like narrowed pulse pressure. Those type of things are more seen with the aortic valve stenosis. Aortic insufficiency, a lot of times they see like the diastolic murmur, sinus tachycardia, exertional dyspnea, palpitations, fatigue, nocturnal angina with like diaphoresis, lightheadedness or fainting. They talk about the widened pulse pressure, bounding arterial pulse on palpation. Those are some of the things that you're going to see with the aortic insufficiency. So some diagnostic procedures that they talk about is obviously a chest x-ray. This shows like the chamber enlargement, so like with stenosis or insufficiencies, and like the pulmonary congestion with like the aortic stenosis. 12-lead electrocardiogram, so the ECG shows chamber hypertrophy. Echocardiogram shows like chamber size, hypertrophy, specific valve dysfunctions. They also look at like the ejection function and the amount of regurgitation flow. They talk about the esophageal electrocardiograph, that TEE. Remember how that actually can show behind the heart. Look at more of those stenosises and things like that. Exercise tolerance testing, stress echocardiograph is used to assess the impact of the valve problem on cardiac functioning, especially during stress. They also talked about the radionuclide studies. This determines the ejection fraction during activity and rest. And then the angiograph is used to evaluate the coronary arteries and the degree of atherosclerosis. Cardiac catheterization might be used as a diagnostics tool in valvular disease also. So nursing care, what are you going to do about this? So you're going to monitor current weight and note any recent changes. We're going to assess the heart rhythm. This can be irregular or bradycardic. You're going to assess the murmur. You're going to administer oxygen and medications as prescribed, assess the hemodynamic monitoring, maintain fluid and sodium restrictions. And then you're going to assist the client to conserve energy, because remember when we talked in all of those, fatigue is one of the huge things, and you're going to help with conserving energy. So some medications, and we've talked about a lot of these medications already in earlier kind of in heart failure and some of those things, but we're going to just briefly touch on them here again today. So diuretics are used to treat that heart failure by removing excessive extracellular fluid. So again, these are the loop diuretics such as like furosemide, thiazide diuretics such as hydrochlorothiazide, and then your potassium sparing diuretics such as your spironolactone. Some nursing considerations when giving diuretics: you're going to administer furosemide IV slower. Remember that, you got to give this over 1 to 2 minutes. Your loop and thiazide diuretics can cause hypokalemia, and a potassium supplement might be required. Some client education when you're giving diuretics: teach clients who are taking loop or thiazide diuretics to ingest food such as dried fruits, nuts, spinach, citrus fruits, bananas, and potatoes, and drinks that are high in potassium to counter hypokalemia effect. You also have your afterload reducing agents. These help the heart pump more easily by altering the resistance to contraction. So you have the angiotensin converting enzymes, so your ACEs, your inhibitors, your enalapril, your like lisinopril, so those pril drugs. Angiotensin receptor blockers, those are like the losartans, valsartans. Your beta blockers, so those are your olols, metoprolol, that type. Calcium channel blockers, amlodipine, some of those, and your vasodilators such as like your hydralazines. So some nursing considerations, we want to monitor clients taking ACE inhibitors for initial dose hypotension. Your inotropic agents, such as digoxin, are used to increase contractility and thereby improve cardiac output. So you're going to teach clients who are self-administering digoxin to remember, this is really important, to count pulse for 1 minute before taking the medication. If the pulse rate is irregular or the pulse rate is outside of the limitation set by the provider, so usually less than 60 a minute or greater than 100, the client should hold the dose and contact the provider. You're going to take the dose of digoxin at the same time every day, and you do not take digoxin at the same time as you take antacids. You want to separate those two medications by at least 2 hours, and we want to make sure that they report signs of toxicity, including fatigue, muscle weakness, confusion, those visual changes, and if they have any loss of appetites. Your anticoagulants, anticoagulation therapy is used for clients who have mechanical valve replacement, atrial fibrillation, or even severe left ventricular dysfunction. Some therapeutic procedures. They also talked a lot about the percutaneous balloon valvuloplasty. So this procedure can open those aortic or mitral valves affected by the stenosis. A catheter is actually inserted through the femoral artery, so we kind of talked about this already, and advanced into the heart. A balloon is inflated at that kind of stenosis lesion area to open the fused area and improve leaflet mobility. They also talk a lot about valve replacement. So this procedure replaces damaged heart valves with mechanical or allografts from like cadavers or autografts formed from the client's pulmonic valve and a portion of the pulmonary artery, so they can take the client's own pulmonic valve and that pulmonary artery and make those autografts. It is often done with an open heart approach. Now, we haven't talked a lot about that, so I want you to kind of look about like open heart surgery, that type of thing. So they break that chest open, kind of get that chest widened out, and so it's a more long, lengthy healing process. A lot of times, anytime that they give mechanical valves or valve replacement, they're put on lifelong anticoagulant therapy. Tissue valves need to be replaced every 7 to 10 years is kind of what they talked about a lot. So some client education that we need to make sure we stress when we're talking with any of our patients. Stress the importance of the prophylactic antibiotic use before any invasive dental or respiratory procedure. Again, trying to prevent any type of infection. We want to make sure they weigh daily and notify the provider of 3-pound gain in 1 day, so like 2 to 3 pound gain, or 5 pounds gain in 1 week. We want to make sure we coordinate activities with planned rest periods. Remember, there's a lot of, with valves and any type of heart issues, there's a lot of fatigue. We want to make sure we encourage the client to follow the prescribed exercise program. We want to make sure that they adhere to any diet restrictions. This includes avoidance of like caffeine, alcohol. Consider like nutritional consultations with like a nutritionist. And we want to talk a lot about open wounds needing to be cleaned carefully, and antibiotic ointment should be used, again, preventing any type of infection to go into that bloodstream. We also want to talk a little bit about read labels like over-the-counter medications to avoid those, which include alcohol or epinephrine, as they might cause dysrhythmias. And then we want to teach symptoms of heart failure, make sure we report those to the provider immediately. So really one of the major complications of this is just heart failure. Heart failure just really is the inability of the heart to maintain adequate circulation. And so we just want to make sure as nurses that we're monitoring the clients and making sure that they have proper output.